Welcome, everybody, to the West Virginia Food is Medicine Coalition Kickoff meeting. Ryan, if you want to go to the next slide for me, please. I appreciate your time for joining the group this afternoon. If you don't mind, please drop your name, your organization, and what county you're in the chat so that we can keep track of who all is here with us today. There we go. They're starting to come in. And Ryan, if you want to advance the slide, I'll go through the objectives real quick. So today's objectives are to bring together stakeholders that are combating food, nutrition, and security and implementing food as medicine initiatives across the state, to collaborate on a shared vision of a food as medicine coalition, to solicit feedback from stakeholders on the values and goals of the coalition, and to identify other key stakeholders to invite to the coalition. All right, Ryan.
All right, so I'm gonna just launch a quick poll for everyone, just so we can get a sense of what types of organizations are being represented by everyone in the room today. So if you wouldn't mind, you should be seeing that pop up on your screen. If you could just take a minute and just self-identify. Folks, another minute. Just, we know the categories might be a little imperfect, but we think we pretty well covered our bases. But if anyone has feedback on any of those, let us know. But just give it a few more seconds. All right. I'm gonna end the poll, and I think I'm turning it back to you again, Hillary, right?
Yep.
All right. Thanks, everyone.
All right, we're going to take just a second to introduce the steering committee for this group. So I'll start with myself. My name's Hillary Payne. I'm the director of the Division of Health Promotion and Chronic Disease within the West Virginia Department of Health. And I'm just going to go in order here. Miranda, do you want to go next?
Sure. I'm Miranda Strickland, the Director of Health and Community Education at Family Care Health Centers, and we are very passionate about food as medicine, doing a lot of food as medicine interventions at Family Care, and really happy to see everybody. And sorry. I was going to turn it over to Gina next.
Yeah, hi everyone. It's great to see so many familiar faces. I'm Gina Wood. I'm a specialist and co-director of the Family Nutrition Program through WVU Extension. I've been working on food as medicine initiatives for the last 5 or 6 years. And I'm going to pass it over to Lauren Wright.
Hey everyone, I'm Lauren Wright. I am the program director and facilitator of the Mounds of Hope Cancer Coalition, and we work with food as medicine as a cancer prevention goal and as a quality of life goal for those who have been diagnosed with cancer and have food insecurity needs. I'll pass it to Laura.
Good afternoon. This is so exciting. My name is Laura Phillips. I'm with Mountaineer Food Bank, and I'm the director of programs there, and food is what we do. So excited to take part of this. I'll pass it over to Dr. Greco.
Hi, thanks for being here. Dr. Carol Antonelli Greco. I am a family physician and co-founder of Pharmacy West Virginia, which is a prescription produce program here in the state. My co-founder is also on the webinar today, and it's Amanda Cummins. She's also here. So thank you so much. And I'll pass it to Tyler.
Hey everyone, my name is Tyler Fuller. I'm the Director of Network and Member Engagement at Facing Hunger Food Bank. and we're excited to see where we can move the food as medicine landscape within the state with everyone here. So thank you for joining. And I think Megan is the last to go.
Thank you all for joining us today. Megan Gvinden, the WVU Institute for Community and Rural Health. Unfortunately, I think some of our other steering committee members were not able to attend today, so I'll pass it back to Ryan or Hillary, sorry.
Yep, it can go right to Ryan. Thank you all for joining today.
Yes, thank you, everyone. Just a real quick hello from myself, Ryan Russo, and Mark Homowecki. We're representing the Camden Coalition, and we've been partnering with the steering committee to help launch this coalition and sort of help build out the partnerships that we're hoping to build today to further the food as medicine cause in the state. So that's just some information about us on the screen. You can read more about that when we send the slides out. So I'm just going to move us along. And I'm going to pass it over to Gina Wood.
Yeah, thanks, Ryan. So I'm going to talk just a little bit about, maybe a little bit of historical context about where this coalition, where this group has been and where we hope to head. But we started getting together as a group of folks who simply oversaw or were implementing food as medicine programs around the state. We started talking a couple of years ago. I think we had all, met through various channels and conferences, and we started recognizing that we were doing similar things, but not necessarily in a coordinated manner. So we started getting together very informally as a group, just sort of talking about, what organizations we represented, what types of food as medicine work we were engaged in, who we were serving. And through those discussions, we chose last year to engage in an environmental scan, very rudimentary, which I'm going to talk about in a moment. But I think, before I get into that, I want to set the stage a little bit and talk about food as medicine and speak a little bit more specifically to how we are currently defining this as a group. I think potentially this definition could use some refinement. This is not necessarily our definition, but it's the one we're using currently. You can see the sort of very broad definition over on the right-hand side of your screen. And then the graphic that you're seeing, if you're not familiar with it, is a food as medicine pyramid that actually came out of Massachusetts, out of Tufts University, who are probably on their 20th year of working in the food as medicine space. So they have lots of experience and have produced a lot of standards and definitions type documents that I think will prove to be pretty useful for this coalition as we move forward. But you can see this framework has 5 levels starting at the bottom, and it ranges. It's sort of a spectrum, in terms of all the way from prevention to treatment. Prevention sort of more at the bottom of the pyramid, and then specific chronic disease style treatment at the top. So at the bottom you have kind of population level policy and policies and strategies, and some examples of those things could include things like tax credits to support healthier food access within small grocery stores, or joint food tax subsidy programs such as taxation on sugar sweetened beverages, where that revenue could be used to support access to nutritious foods in lower income neighborhoods. And then taking a step up one level, you see the broader nutrition security programs that many of us are used to hearing about, like SNAP, WIC, and national school lunch and breakfast programs. And then kind of in the center, we have produce prescription programs, which are really meant for people with diet sensitive chronic illness who are able to shop for and prepare food, but they may have financial limitations in terms of accessing nutritious food. So these programs provide low or no cost fruits and vegetables, usually via farmers markets or retail outlets, and they're usually co-located at a healthcare facility or another community-based location. And on the 4th level, we have medically tailored groceries, and they are also programs and strategies for people with diet-sensitive chronic illness who can prepare their own food, but they, again, may have some financial limitations or difficulty physically accessing a grocery store, which we know is true for so many West Virginia communities. These groceries are customized to the individual based on their condition. Typically, a referral is required from a healthcare provider or health plan. A dietitian is typically involved in the care of this individual. And then food is either delivered to the home or available for pickup at a healthcare facility or other community location like a food pantry. And then at the very, very top, we have, the very specialized medically tailored meals, which are pre-prepared meals for people with complex and chronic illnesses who are unable to shop for, and they're also unable to prepare food. That requires a referral, again, from a medical provider or health plan. Those meals are developed in consultation with a registered dietitian. They're highly individualized, they're highly personalized, and require very specific adherence to nutrition standards, which I think is where the definition, the standards and definitions and things like that will come into play in the future as we build the coalition and decide on our purpose. So next slide, Ryan, if you don't mind. So at the very, beginning of these discussions, we started talking again about what we were doing, who we were serving, and we were encouraged to do an environmental scan. So we did that in 2024. I think we released the results probably in September-ish, October of 2024. It was pretty rudimentary in terms of the data that we collected and the questions that we asked. But you can see that the resulting map, the ecosystem map that you see here on the slide is very patchwork. And I think it's representative of the nature of the work that we were all engaged in. Separate organizations doing separate things, but sometimes in the same communities or even with the same healthcare partners. And we have this sort of what I like to call our patchwork quilt of food as medicine programs. And I think that's pretty typical in terms of organizations that are responding to the acute needs of their patients and communities. We're all out there trying to do the best that we can with the resources that we have, but we're not always necessarily coordinating with other partners who are doing similar work. And I think that's very evident by the map that you see here. And I don't know if Josh Lonez from the Food Justice Lab is on the call today, but I threw all the data at Josh and he was able to make sense of it and create this map. And we hope to be able to continue to do this type of ecosystem map from time to time across the state. And at the time, we didn't even know of all of the players and all the partners who were doing food as medicine work. So, I think, even if we did this today, even just, less than a year later, we would find this map potentially looking very differently. So you can see some of the results on the left-hand side. You can see that 40 out of West Virginia's 55 counties had food as medicine programming. The majority of those were produce prescriptions. Over a third of organizations who were implementing food as medicine indicated that they oversaw more than one type of program, and the conditions most often prioritized were hypertension, obesity, and prediabetes. So Ryan, if you want to just shift over to the next slide. We also asked the folks who were implementing food as medicine programs, what were their primary barriers to implementation? You can see those on the left, and they're listed in order from the barrier that was the most cited to the barrier that was the least cited. And you can see these are a mix of barriers that are very, very programmatic in nature, but also ones that are, have more systems related concerns. They're more systemic in nature in terms of lack of sustainable funding, lack of support for program evaluation, and lack of support for program coordination and implementation. I also want to point out that one of the barriers that was listed was access to fresh, locally grown produce. Most of the stakeholders that we surveyed were using fresh, locally grown produce in their programs, but 92% of them felt that accessing that produce was a barrier. So, I think that's an important point to point out, and it's something that we want to address through this coalition. I think, we want to be able to build generative models that are fair to local growers. We definitely want to use this coalition to advance food security, and I think we want to make sure that our local farmers and their voices are incorporated into the coalition. So I think that's an important thing to point out as well. So with that, I'm going to, I think, turn it back to Miranda, who's going to talk a little bit more about the structure and approach and the values of the coalition.
Thank you, Gina. It's a great summary. It's so great to see everybody. We're really happy that you took the time to be here with us. We know that everybody has really busy schedules, so I'm just really thankful that you're here. And so I'm going to start with the approach of, we realized in the beginning.
Miranda.
Oh, can you not hear me?
Her?
I can hear her.
Oh. I can hear you, Gina. I don't know. But we realized in the beginning that, there were people that were missing in what we were doing. And so we really wanted to make sure that, that everybody does feel like they have a place at the table and that we work together. I think that's something that, we know the health condition of West Virginia, everybody knows that. And so we really need to come together to really make a difference and be able to improve health outcomes. So as a coalition with a shared vision, we kind of developed some values that we thought were really important in the beginning. And, feel free, we can add to these values, but our steering committee started meeting. And so we kind of just developed some basic ideas of what values we thought were important. And so number one, I think really important is improved health outcomes. So that's why we do the work. We want to move this needle. We're tired of being number one for these conditions and disease states. And so we really want to see things get better. And then health equity is also an important part of that. We know that food insecurity, nutrition insecurity are big issues in West Virginia, and that those things lead to poor health outcomes. We wanted collaboration, so we want to be able to work together with different partners. We know together we can get more accomplished than we can working individually and in silos. So that was really important. Cross sectors, so we want to work across multiple sectors, not just healthcare, not just farmers, but us all coming together to move this work forward. We do want it to be evidence-based, but also practice-informed. So, we can know that evidence shows that this is effective, but is it effective in our practices? Are we able to do the things that the evidence shows are effective? And so I think that's a big thing, is making sure that the practices are able to do it. Food as medicine is very, a big thing about it. It does involve the healthcare sector. And we know the healthcare sector providers are very busy. They don't have a lot of time. And so can we work with them to figure out how we can improve health outcomes? And then community driven. So a big person about involving community voice. So, there's an approach called the positive deviance approach, and it actually says that communities know how to help their problems. They know what to do. And so a lot of times I think we miss out on talking to them and figuring out what's going to help them be healthier. And so that's really important that we do that. So that's kind of what we developed out of this. So we started with Camden Coalition. From Camden Coalition kind of developed this structure of thinking about having a steering committee who meets regularly. So we've currently been meeting once a week. We understand that as a coalition, everybody's not going to be able to do that and put that time into it. So we started, we kind of thought we'll have this steering committee that oversees the work of the coalition. And then we build this coalition that is able to meet, we haven't figured all this out. And this is why we want you guys here today to kind of help us figure this out. But does the coalition meet monthly? Do they meet quarterly? Like, what does that look like for everybody? So kind of, we want your help in figuring this out. But basically the coalition is going to be a broader group so that we can involve all of those sectors to kind of speak to this food as medicine work. And we put a potential vision as access to healthy food for all West Virginians. So we know that we have to provide healthy food. So, it's really important that it is making them healthy, that it's improving their disease states, that it's something that is not going to make their diabetes worse. And healthy can be defined differently for different people, but, you know, we can say nutritious or, you know, but we want to just make sure that it leads to health outcome improvement. And then we left the mission to be determined. We really want the coalition to help steer what that mission is going to be. Again, we are in the early stages of all of this, which is why we wanted to bring you in early to kind of help us figure all this out. And then from the coalition, we, you know, envision developing working groups where people would break into smaller groups. We want to be a working coalition. So, you know, we don't want to just be having meetings and not accomplish anything. We are all really passionate about seeing this work advancing. We want food as medicine to advance in West Virginia and to see that health outcome improvement. So we know we're going to have to work, and sometimes that's easier to do in a smaller group. So we kind of see creating some working groups. And then other activities could be, you know, getting stakeholder feedback, doing focus groups, just different things to help steer this coalition. And then the consultant, which is Camden Coalition, they're going to be involved with all of that work, kind of helping us to know where to go. And they've been a huge help, honestly, just putting things together. We're really excited that we're able to work with them. So they'll be involved with the steering committee and coalition and all of those things. So this is where you guys kind of come in, that we do want your feedback to help us kind of determine what direction we want to go in. And so we're kind of trying to figure out, should we go broad? Should we go narrow? I think, you know, food as medicine is a very hot topic nationally right now. You know, everybody is excited about it. And so we want to make sure that we keep the integrity of food as medicine, that we're noticing that health outcome improvement, which is going to lead to reimbursement through insurance companies, and to be able, you know, we want everybody to have access to that, to those services. And that comes through seeing health outcome improvement and the benefits of it. And in order for that to happen, we have to do it effectively. So thinking about, do we keep, you know, is food as medicine too narrow and we want to go broader to like focusing on nutrition and security, and food as medicine is a component of that? Or do we make it food as medicine focused and then kind of break out in smaller groups around food as medicine? So, you know, policy is a part of food as medicine. There are nutrition education, culinary education, different things that go into food as medicine. So I think that's kind of, you know, where we're going with that. Do we keep it broad? Do we narrow it? What would you like? So do you guys have any feedback about that? Like, what are your thoughts about that? And feel free to please come off mute. I think they can do that, Ryan, just unmute themselves, right? And be able to
Correct.
talk. So you can do that. You can put information or your thoughts in the chat, whichever you're most comfortable with. I know we have a large group, but we want this to be guided by all of you. That's so important, I think, to get everybody's voices. And so that's why you're here. We are happy you're here. So I'm going to pause and give people time to share. Survey. I like that idea. We actually had planned to do that after this meeting, to do a follow-up survey to get feedback about that, because yeah, I think definitely that was to gauge the group. So yeah, we can do that. Does anybody have any ideas now before the survey that they feel comfortable sharing about your idea, focusing on food as medicine and the components that come with that, or focusing on a broader area?
I can jump in. I don't know if this will, you know, potentially stimulate some discussion, but obviously food as medicine is large, right? It's very broad. It's a big topic. It's complex. And there is a lot of work to be done across the state if we are going to get to a point where we have, you know, some reimbursable models for this work. Having said that, I think, you know, engaging in food as medicine work and engaging in this space and advancing it outside of the context of what's happening with nutrition security efforts and initiatives around the state potentially might be a missed opportunity. You know, there's lots of things happening, especially in light of you know, what is happening you know, in the federal landscape right now around you know, nutrition and nutrition security programs. But you know, there are lots of other folks around the state, some of whom are on this call today, who are engaged in broader nutrition security efforts, policy initiatives around nutrition security that, you know, I think if we do this, you know, outside of that context or without that context, then, you know, potentially we may be missing an opportunity. So that's sort of like two ends of the spectrum there, but you know, just some things for consideration.
Thank you, Tina.
And maybe some other food for thought, if I could jump in here real quick. We've thought about different things with regard to healthy food access. We know that healthy food access is important, but we also know that education is important. And we need to, at some point, I think, look at standardization for education, nutrition and culinary education, perhaps across the state, and also look at health metric collection. You know, as far as data collection, it's extremely important to be able to create a sustainable environment for this program. So there's groups such as American Heart Association that are working now to develop standardization in health metric collection. And so, again, I think that's probably at some point we're going to focus on that also. So just maybe your thoughts with regard to those two things: data collection, standardization, and education standardization. Thank you.
Miranda, can you hear me?
Yep, sure
Okay,
can.
sorry. Yeah, so, you know, representing one of the payers, which I think I see representation from all of the MCOs on the line, but who I don't see is anybody from the state Medicaid program. And, you know, while each of the MCOs can certainly do things to partner with organizations, I mean, I know we have our relationship. You know, we do have a finite number of resources ourselves to try and work with folks. So, I mean, I think there has to be a mindset change where we need to try and shift the Medicaid program to really look at those in lieu of services, so that we have dollars available to us to invest in things outside of the medical arena. You know, if we can shift those dollars to different types of investments, we can see reductions in medical costs, as you all have spoken about. But we've got to get the state on board with that model. Now, granted, they can submit a waiver and the federal government could deny it. You know, I don't know what happened there, but I think that's one starting point on the payer side.
Thank you, Jeff. Yeah, I agree. Yeah, I don't know if you guys know, so in Oklahoma, they just passed a Food as Medicine Act, and now that allows the insurance companies, they have to reimburse for food as medicine, which is beautiful. So yeah, we're definitely very interested in lieu of services, and that's one of the things we've talked about. So yeah, I agree. And actually thinking about, so, you know, the other question is, are there people missing today who should be invited? And so, yeah, I think you make a good point, Jeff. We need to make sure that we invite somebody from Medicaid. And I don't know who that person is. If you know, Jeff, who that person is, could you put their name in the chat? Because yeah, I think we are developing a spreadsheet of people that, so if you have an idea of who you think should also be involved, please let us know and put that in the chat or give us that name. So the initiative being funding, or how it's being funded. So currently the smaller group that started these conversations, we together wrote an AARP grant, a capacity building grant, and that's how we were able to get the Camden Coalition. We just submitted a block grant to get more funding to do more things with the coalition and to extend the Camden Coalition's consulting. But yes, funding is definitely something that I guess I was gonna mention it in project goals. I don't know if we want to go there. Let me see if I have any questions. Let's go to that because I think that will. So these were some of the project goals that we kind of came up with initially for the coalition. And again, we may develop more, but we just kind of wanted to lay out a little bit of a direction. So goal 1 was expand and strengthen the Food as Medicine Coalition and codify name, mission, and vision in a coalition charter. So that's something that's definitely going to happen as part of the coalition. Goal 2, launch working groups and other activities to target specific priorities and advance the coalition's mission. Number 3, identify and secure ongoing funding opportunities. So we realize this work, there's going to have to be funding involved with it. So that's definitely something that as a coalition, we want to do so that we don't want this to be something that, we start and then it goes away. We want this work to be sustainable. And that was our purpose in building the coalition. Like, I realized in going to national food as medicine conferences that the only way that we're really going to be able to do this is through policy and through working together. And so that's really we've realized we're going to have to have future funding. It's going to probably take years to develop this, but we want to work together on it so that we can further it quicker. And then goal 4, identify and outline an administrative and organizational framework. So for the Food as Medicine Coalition. So we've talked about community care hubs, which the Camden Coalition is very familiar with. They have assisted other states with developing community care hubs. And basically that's like a centralized place that you have data sharing, evaluation, all of those things, administrative things. And so that's the direction that we were thinking about going. And then draft and iterate a strategic plan for the Food as Medicine Coalition. So again, we want this to be something that is sustainable. So how do we, we don't want to go grant to grant to grant to do food as medicine. How do we provide it to people? For example, at family care, I can only help patients that are family care patients. I can't help other patients, but there are so many other patients that need food as medicine. So how can we help advance it so that a patient that really needs it can get it regardless of health system, regardless of where they are? That's our goal. So I hope that helps about the funding. I'm excited that you guys are putting names down. That looks great. But yeah, and we realized too, Gina and I were actually just talking this morning about we need experts. So we need dietitians who are experts about nutrition education and these things. And like I said, we were talking food as medicine is very broad. And there's a lot of conversation around it, but helping to define what it is and, what services we're providing are really important so that we keep those health outcome improvements because that's what we're looking for. We want patients' health to improve, and we've seen that, but we need to be able to show that and prove that it works.
I'm going to jump in here with a question or a comment. As a farmer forward organization, and we work with Pharmacy West Virginia and have done so for many years. The question I have for this coalition is, when we're saying food as medicine, are we talking strictly local farmers, or are we considering, trying to get people into Walmarts and anywhere that will service them with produce, or are we going strictly local? Because as referenced in your study, 92% I think had issues with finding the local produce to sustain the programs. So kind of like starting a farmer's market, if you're going to have a produce-based local food system, you have to start with the food.
Thank you, Holly. That's a great question. And honestly, I find that at family care. So, you know, a lot of our patients cannot go to the capital market. They don't have access to that. So I think you bring up a great point. My dream, honestly, Holly, is to get the local farmers to sell their local food at Kroger and Walmart, because that's where people shop, so that, you know, we can have that. That would be my, like, if I had the magic wand, that's what I would do, because it's so hard for people to sometimes get to those places. But you know, I definitely think I think there's a place for both. That's what I would say. I don't know if other people have input. I think local is important. Go ahead, Dr. Greco.
Yeah, you know, Holly, our focus has been on West Virginia farmers. I think at this point, we haven't advertised enough. I'm speaking specifically from our point of view, Pharmacy West Virginia point of view, that the word is getting out there and there are farmers available. Now, are there enough farmers available? And do they need to be trained to do programs like this? You know, scaling up to provide the produce that's needed for, you know, food as medicine programs. I think personally, I think it's probably almost doable with what we have in West Virginia, but, you know, at some point we may need to add grocery stores and we may need to add, you know, other avenues of providing food. So at this point, though, we really want to support the West Virginia agricultural environment and help out our local farmers.
Yeah, I would agree with that. I think, you know, many of us, most of us have prioritized purchasing locally raised and grown food. And I think, you know, maybe there's potential to expand that to other things other than produce, to meat and to eggs, you know, which make up the bulk of calories in the diet. I think those things are important. There may need to be a mix of retail and locally produced food at first, but I think there is a food systems development component to this that we absolutely need to incorporate and address. You know, Megan put in the chat, pay farmers a living wage. Yes, pay farmers a living wage, and everyone for that matter. You know, it is something that we definitely want to prioritize. And I think, you know, we recognize there are lots of for-profit companies that are existing and emerging at a very rapid pace to take advantage of the growth of food as medicine nationally. And I think, you know, that is something that we would like to avoid. You know, we want to avoid those kind of extractive models, right? We want to support community-driven initiatives and solutions, and that includes locally grown food. You know, we don't want to, you know, have out-of-state large companies, you know, making a profit off of West Virginia to address our food as medicine needs or our nutrition security needs. You know, we definitely want to support, you know, local organizations and locally built solutions. And I think that's, you know, hopefully this group with all of your expertise and input can be the start of that.
I would like to just quickly jump in and share something. I'm program coordinator for CDC's HOP High Obesity Program project. And one of the things that we do is there are like 4 main strategies that we're focusing. And one of them is actually related to produce and vegetable voucher programs and produce prescription programs. That's like one of our strategies. And we actually have conducted a lot of community meetings over the last year and also in this year as well. And what we have learned that in a lot of those meetings, when we are explaining that what is this program is all about, like what is food is medicine or what is produce prescription, I think there is a lack of general understanding about what that is and how that process actually works. So definitely in terms of like thinking about the scope of this coalition, I think if we can the scope a little bit more to include more people. So just expanding the umbrella a little bit more to include more people who'd be benefited with this process, I think that would be really helpful. Because I think in general, there is a lack of knowledge in the community to actually get, decent understanding about what this process is and how food can be treated as medicine and what's the importance of having a better nutrition in their everyday life. So I think if we can expand that and include more people, especially in the rural communities, priority-wise, I think that would be something great to achieve in the future.
Thank you. That was very good. I agree. The other thing I would bring up too is the hard thing with the farmers is that a lot of them can't grow year round, and so that's the hard thing is that we can pharmacy is mostly in the summer months, but then what happens in the other months when they do need food, and so there's that disconnect. But yeah, I think there's definitely a place and should be a place for local, but I think we do have to realize there are barriers with that and with patients having access to those things. Any other comments or questions? Thank you for your feedback. Ryan, do we want to do the breakout rooms now?
Yeah, let's do it. So
okay, 15 minutes.
Well, yeah. So what we're going to do is we're going to just we're going to break out into small groups. I'm about to open them now, and we're just going to back up a little bit and just to open up some space to either continue some of the stuff that we've been talking about in the large group, or the discussion questions that you're seeing here, which will be available to you in the breakout rooms. Just talk about, something about this that excites you, maybe something that's making you nervous, and thinking about, your organization and your work and sort of like what your superpowers are, or what you can contribute, just to sort of start the brainstorming process. So I'm going to open the groups, and then we'll have about 10 to 12 minutes, and then we'll reconvene and we'll talk next steps for the group. So I am going to open those now. And for those who have to jump a little bit early, the next meeting is going to be on July 10th, and the invite for that will be going out right after this meeting. So in the meantime, let's jump in those breakout rooms, and we'll see you all back here in about 10 to 12 minutes. Thank you all, everyone. A lot of really great conversations happening, and really just thank you all so much for your enthusiasm and your feedback and your time and your ideas and your collaboration. I could go on, but I want to wrap things up, so I want to be mindful of the time. Some upcoming meeting dates. These invites will be going out right after this meeting. We'll be meeting again as a coalition on Thursday, July 10th at 2 p.m., again in August. And we are planning an in-person meeting in September, Thursday, September 18th, at the Stonewall Resort. We're ironing out these last details, but you'll be hearing more about that. We're really excited to get that off the ground, and we'll just be continuing the work we've been doing that were kicked off here throughout the summer. And by Monday, everyone, even if for folks who weren't able to be here, we'll be sending out a high-level overview, a link to the recording for folks to share with their colleagues who maybe weren't able to join us, a copy of the slides, and then a feedback form, which will give folks a chance to maybe marinate on the ideas we've been discussing and share what maybe came up for you after this. So thank you so much. I know we're at the top of the hour, so just really appreciate your time again, and I hope you all enjoy the rest of your day. Thank you so much.